Hello.
How you doing?
Good.
All right. Can you tell us your name?
My name is Nikki Manichetti, and I'm 37 years old.
Great. What do you do?
I'm a nursing student.
All right. So, and can you tell us what your diagnosis was when you came in?
Yes, I tore my meniscus and I had meniscus repair surgery about 3 years ago.
Okay.
But my knee was not quite the same, even with physical therapy and getting the repair surgery done.
Got it. What kind of symptoms were you having?
Just pain, really on like exercise, like running, squatting, on stairs.
Okay.
Like
And I know you now, so I know you have a high pain threshold, so you put up with a lot, but still you were kind of like, I can't do what I want to do.
Exactly.
Okay. And so you weren't thriving the way you wanted to, and so we decided to treat you not just kind of like a PRP into the knee and good luck. We did that kind of three-part series where we saw you the first time, injected leukocyte-rich PRP into your meniscus and leukocyte-poor PRP into your knee joint, and then you came back a week or so later. We just went into the joint, and then we went back into the meniscus on week 3. Now, again, your high pain threshold, I know you went and had these, procedures and then went and took a test for your nursing school the same day. So you were like a very easy person for me to deal with. But like, what was your experience with the procedure? Was it a lot of pain, a lot of swelling?
Honestly, it was more like downtime than I expected. I thought it was gonna be like a cortisone injection. I thought you were gonna come in, you're gonna inject me, and I was gonna be like hopping out.
My bad.
No. It was really. I didn't quite realize, but I was fine. Like you said, I was walking steps that day. There's steps to my house. I was able to take that test, care for my children by myself. My husband was out of town one of the days.
Right.
So it was not that.
Okay,
bad.
good.
Yeah.
And then we had you, just because you were the meniscus issue, we kind of had you brace a little bit afterwards, but that wasn't too bad.
No,
Okay.
I left it for that whole throughout the PRP injections and then 1 week afterwards. And
Good.
I kind of liked it. I felt like it reminded me to like take it easy.
That was the intent.
Yeah.
And then how far out are we now after the procedure?
2 weeks, 3 weeks, 3 weeks.
After the
The 17th. So we're 3 weeks. Yeah.
after the third one. Okay. And then how are you doing?
I'm doing good. I think I'm back to definitely baseline, and maybe a little bit better.
Okay.
Every time I see Megan, I feel a little bit better.
Yeah. So and then what are we doing now?
We're doing the shockwave.
Right. So this is kind of one of our added things that we do after most of our procedures, whether it's a knee or the spine or the hip, whatever it is. We're going to add these mechanical energy things like shockwave, laser, EMTT. They kind of accelerate the speeding process, the healing process. So Megan is fantastic to know where to go and know where the pathology is and kind of target right over those areas. So how's that been? Not too.
No, it's been great actually. Yeah, I really. And I can tell her like where I feel a little bit more, and she focuses a little more. So I've been feeling really good.
A lot of feedback.
Yeah.
Okay. Anything else you'd like to tell people who are thinking of like maybe getting their knee treated with PRP?
Do it.
Okay.
I like really didn't know about it until a friend told me.
Right.
And then once I knew about it, then I felt like the more people I talked about it, the knew about it. So it's like the word needs to spread.
I agree.
And especially like in my age group, people that are active and still want to be active, but maybe have a little something that's kind of holding them back or that's going to get worse.
Right.
So
treating it before it gets worse.
Yes, exactly. So that you can be active for your whole life.
Because we know that meniscal tears, if they're not fully healed, they can lead to our early onset arthritis. And so we're maybe doing some preventative maintenance now.
Right.
Okay, great. Well, high five. Good luck with everything.
Thank
Good
you.
luck with your travels and
Thank you.
studies, and you just let us know what you need.
All right. Thanks, Dad.
Thanks, Mick. Appreciate it.